Hey, good morning, Facebook. Just wanted to share some really cool results and things that have happened recently here in the office. So last Wednesday was World Mental Health Awareness Day, and it also happened to coincide with the National Spinal Health Awareness Month. And so I wanted to share some really amazing and cool results for a young man, a 23-year-old patient here in our office who came in with major depression and anxiety. And we had him fill out this Beck Depression Inventory, this checklist, which rates and scores how depressed someone is. And when he first filled it out 2 months ago, he was at a 36, which is considered severe depression. And then just 2 days ago, actually on Mental Health Awareness Day, he scored a 17, which is considered mild depression. And this is something that is not uncommon. It's actually... Now, what's the correlation between mental health and spinal health? As you know, many of you know, I'm a chiropractor. The connection is the upper cervical spine, the upper neck. This is an area that controls the many of the major nerve centers in the body. We have the autonomic nervous system, which controls the fight or flight response. And if we're living in a fight or flight response, then we're going to be in a state of anxiety, a state of breakdown, because we're not getting into the other side of that autonomic nervous system, which is the resting, healing, digesting side of things. And so many of you might be wondering, how does chiropractic help people with these different situations like depression and anxiety? And I can tell you it's nothing new. In fact, chiropractors used to have mental health sanitariums back in the early years, in the 20s, 30s, 40s. We had these types of hospitals that were helping these sick get well, people with these mental health challenges. And even that term mental health, I believe we really need to start looking at it not even calling it a mental health, but referring it to as physical health, because so many of these individuals with these challenges are not having issues with their mind as much as they're having issues with their body, their nervous system, their digestive system, the gut. Next week I'm giving a presentation on the gut-brain connection, and we know scientifically that the gastrointestinal system is closely connected to the brain and brain function, inflammation in the brain, which then creates mental health challenges. It creates problems that unfortunately the primary care method has become trying to talk these things through, or trying to medicate and change the brain chemistry, when these are many times nervous system and brain and gut issues. And so if you know anyone that is having these challenges, if you're having these challenges, I'd encourage you to come to that workshop. We're having that workshop next week on Wednesday, the 17th. That's the Gut-Brain Connection workshop. And the following week, we're having the Mental Health Matters workshop, which is on Monday, the 22nd. And then on November 1st, I've been invited to speak at the NAMI meeting here in San Diego. It's the National Alliance for Mental Illness. And I'll be talking about those subjects as well. So there's lots of opportunities. And the thing is, opportunities come and go. And so many times we miss those opportunities. You may know someone in your life who's struggling right now, who needs to hear this message. You may be struggling yourself. Take advantage of this opportunity. If you're outside of San Diego, or that loved one is outside of San Diego, let us know. Send us a message, and I will help find a chiropractor who knows how to address specifically the upper neck and those issues in the upper cervical spine that I had mentioned that could be potentially contributing to some of these mental health challenges that you or your loved one's facing. Thanks so much. I got to go get to taking care of patients here, and I look forward to seeing you next time. All right, take care.